From last week's historic Supreme Court arguments to the titanic fight coming in the fall presidential race, there is no question health care remains a big issue. One big reason, of course, there are astronomical amounts of money flowing through the system. It's 1/6 of our entire economy. That kind of money, of course, attracts fraud, and fraud costs government programs like Medicare and Medicaid an estimated $80 billion a year. CNBC's senior correspondent Scott Cohn and his team have spent months on the front lines of this. He's found that this health care hustle can be as easy as changing a few numbers on a claim form.
American health care in the 21st century is a numbers game. Every diagnosis, every procedure has a billing code. The newest list of codes, which goes into effect in 2013, is more than 1,600 pages long. From code M169, arthritis of the hip, to code W273XXA, contact with a sewing needle, initial encounter, not to be confused with W273XXD, contact with a sewing needle, subsequent encounter.
Contact with a sewing needle, initial encounter. Contact with a sewing needle, subsequent encounter.
We've built our medical care system in this country around a fee-for-service model.
Dr. Peter Budetti is the keeper of the codes. He's the Deputy Administrator of Medicare and Medicaid in charge of program integrity.
We have to describe what we're going to pay, that's the fee side of it, and what the service is that was delivered.
Making the codes so specific is supposed to help root out a type of fraud known as upcoding, where providers bill inflated fees for minor procedures. The codes are a minefield for some, but a potential gold mine for others.
Hi, I'm Dr. Adam Alpers. Thank you for registering with my site so that I can share with you the #1 coding secret for maximizing your revenues.
Adam Alpers is an osteopath in Ocala, Florida, with an internet business on the side.
This simple technique could generate anywhere between $10,000 and $15,000 in additional revenue for your practice.
For the low price of $349, Alpers offers a video series he calls Medical Coding Cash Secrets. We purchased the program and learned how you can bill Medicare for telling your patients to quit smoking.
If you address the issue in the manner that I will show you in the Medical Coding Cash Secrets program, and code the visit properly and reach that higher billing level, you will easily generate $10,000 or more additional revenue each year using this smoking cessation code.
In another video, he shows how a 6-minute walk down the hall can be billed as a pulmonary stress test.
Dr. Alpers?
Yeah. We wanted to ask Dr. Alpers about his medical coding cash secrets, but he wasn't interested in speaking with us.
No? Why not? Did you turn that off?
Off camera, Alpers told us he's simply trying to help healthcare professionals to do the right thing.
I'm offering you an opportunity to improve your practice in ways that you never imagined.
On his website, Dr. Alpers offers glowing testimonials from his fellow healthcare professionals.
Thanks for teaching me about the 999 codes. I've been using your techniques for almost 6 months.
Like Dr. Jay Williams of La Crosse, Wisconsin.
My revenue has increased in the thousands of dollars monthly.
There's just one problem.
Well, I was surprised that he would use that without asking my permission. And I also was surprised at the testimonial because it is factually not correct.
Williams told us that while he has worked with Dr. Alpers, he's never heard of the program, let alone used it to increase his revenue. He also hasn't practiced in La Crosse, Wisconsin for years. We also contacted R. Zillis, an Ocala, Florida nurse practitioner, quoted as saying, "You've taken my revenue to a new level." That's Zillis's picture on one version of the website. Well, it turns out that she,
and I am sure it will make anyone who uses it a better coder,
is a he. The only nurse practitioner named R. Zillis listed in Ocala is Rob Zillis. He told us he does know of Dr. Alpers, but not his program.
That's not my testimonial. I'm not sure why my name was used on the website. I'm just not familiar with, and up until just a few days ago, had no knowledge of it.
So we contacted Dr. Alpers again. This time he responded in an email. He says he really did work with Williams and Zillis, but acknowledges it was before he had a program. I discussed with them my desire to find a way to make the guidelines more clear, he writes. I asked them if I could use them as a testimonial to my teaching and if I could use their comments on a website that I was developing. He claims they both agreed, but he didn't get it in writing.
In his course materials, Dr. Alpers says he's merely teaching doctors how to use the right billing codes for things they're already doing, and at least in theory, there's nothing wrong with that. But the line between proper accounting and hustling the system is a growing focus for the authorities.
And play you his promotional video.
So we took Dr. Alpers' materials to Washington. Gary Cantrell is Deputy HHS Inspector General in charge of investigations.
Code for smoking cessation so that you can earn the higher allowable rate.
I guess my initial reaction is there's clearly a fine line between education and suggesting upcoding. And I think he was careful about his words, and that would be my first concern, is the potential that this kind of advice, which he didn't get into any details, but could certainly lead to upcoding. And so we would be interested in looking more at that situation.
They may not be able to. Soon after we began asking questions, Dr. Alpers took his website down for maintenance.
And you can see more of Scott Cohn's reporting on the war against healthcare fraud in the new CNBC documentary, Healthcare Hustle. It premieres next Monday, April 9th at 9 Eastern and Pacific.